I'm going to let Emma and Grace take the first phase, talking about the groupie.
We're gonna put like a roll on there just to kind of see what time so many times where we could just get a room and if y'all had questions, we could go over things or just like set it a few times before text. Yeah, so how much and there's a couple of things up here and you don't get it for these first.
And I'll add to the GroupMe project. If I'll be more than happy to send you guys like some extra practice or some extra examples that you can then share with whoever wants to come up or work with you guys to find some outside of class experience and make it work your times. Awesome. So group us. Back in mind, Harry. It's all so cool and neat. All right, guys. So for the flag, I'm actually going to lecture without the background because, as you guys know, like gravity is in the field. It's hard to see, not only on your end, but on the videos. They can, what are we even doing? It's not my fault. It's not your fault. Just, it is what it is. So what I'm going to do is I'm going to have the projector up on the side, and I'm going to communicate to the videos where we're at, what page we're on, what we're doing. So that way you can reference it. If you're rewatching, you'll be able to reference while I lecture. But I think it'll just add more clarity. Okay. All right. So what are we working towards? We're working towards understanding how specific muscles influence specific motions through the context of muscle contractions. In 310, I gave you almost all of that. But I also am realistic to understand that we can't remember all the stuff we had in one class. Or at least we need to kind of refresh some of these things before we move on to the next step. So like we might be on step number 3, but we might need to start back at the beginning. I'm not saying all the way to the beginning, but just to refresh us, to get us up to get our bodies accumulated to the verbiage and to some of the illusions and to the contractions before we take the next steps on our journey to understanding how specific muscles influence specific motions through contractions, okay? So what we're going to do today is we're going to do a refresher on specific joint motions and especially those illusions that we have. You remember in 310, with those, we're doing the pelvis and how crazy that was and the trunk to pelvis and all that stuff. So think of it like this. There's going to be a time where I'm going to ask you this question. Let's see. Don't laugh. I have dyslexia. You can laugh. I don't mind. I do have dyslexia, but you can totally laugh. It's so crazy being a professor and having dyslexia. Like people assume I write like I spell. I'm like, guys, my doctorate is not in English. We are going to have to, for this class, be able to identify which specific muscles are maintaining that position. And we can't use the word for. I see why people do it, because they don't know. And that's okay. They weren't trained. They weren't taught process. They weren't taught to figure that out. You guys will be. So on the test, I'm going to need you to identify which specific obliques, which specific erector spinae, because in the real world, there may be a client or patient. If you guys are listening to this analogy, just pause it or if you're rewatching the videos, take a picture of it. And that way you could have it while guys, there may be patients where it's contraindicated for certain conditions to work a specific oblique or indicated. There may be a muscle imbalance. There may be a neural reason we need to really emphasize our left external. or our left internal. We have to know what those things do. We need to know how they pull. We need to know how to be able to set up the exercises. There may be times where you have to work this specific muscle, and during this phase, just concentrics only. You may have to work this specific muscle, and in this phase, isometric only. You may have to work this specific muscle, and in this particular phase, eccentric only. We need to learn how to control those variables. We need to learn how to see those variables. We have to be beyond cool. Does that make sense? Okay. So this example in particular in 310, where let's say we finished 310 on step number 3. Some of you may have had 310 recently, this summer and the spring. But guys, I've had students that haven't taken 310 in a year or more. So I'm not saying we're going to spend a ton of time on it, but we need to refresh our memory, and then you can do the extra that you need to make sure you're conditioned for us to move forward, okay? So if y'all remember from 310, the pelvis can move about the trunk. Pelvis was like a basketball, or the pelvis is like a bucket. And the pelvis can rotate, but something has to rotate it. The basketball can't spin itself. If the basketball spins itself, you have a possessed basketball. We have to spin it. And if you remember on 310, I can either spin it with my hands on the bottom, one hand on the bottom, that would be like a right hip analogy, left hip analogy, both hips. Or I could palm it on the top and spin it like this, and that was the trunk. So if I'm looking at this in this example, gravity is trying to rotate my pelvis to the left. But in doing so, it's trying to rotate my trunk to my right. Do you guys remember that? So gravity is trying to cause right transverse trunk rotation. I can prove it to you. We know that if sternum is lined up with our pelvis, there's no obliquity, there's no rotation, it's lined up. If my sternum is looking more at my right hip, I have to be twisted to the right. And if my sternum is looking at my left hip, I have to be twisted to the left. And that can happen either moving the small piece about the big piece or moving the big piece about the small piece. If I do this, my sternum's looking at my right hip, my trunk had to rotate to the right. So gravity is trying to make my sternum look more at my right hip. The sternum's already twisted to the right. Does that make sense? And if I let my legs fall, it's going to be twisted more to the right. Does that make sense? So in 310, we talked about looking at agonists. Who do you need because you understand why you need them? And they were in groups. We didn't get into the obliques. We said you have right transverse trunk pullers and left transverse trunk pullers. Muscles that pull you this way and muscles that pull you that way. So if gravity is trying to twist your trunk to your right, do we need muscles that are also trying to twist your trunk to your right? No. Does that make a logical sense? You don't have to see the muscles literally. Does the concept make sense? If I have a machine or an exercise trying to spin my trunk to its right, if I use muscles to do that, I would literally slam my feet onto the ground. That would be like having a tug of war and both teams on one side of the road with no team on the other side. It's impossible to maintain that position isometrically if you have muscles pulling in the same direction as gravity. Make sense? So because I can prove that I don't need right transverse trunk rotators, then I must need left. I must need muscles that are pulling my trunk this way. Now, it looks like it's moving, and it is. You're going to see muscles that do this, but the same muscles that pull this way are trying to pull the pelvis the other way. That's what I'm trying to get at. And I'm going to teach you who those muscles are. I'm going to teach you about the right external working with the left internal, like a Chewbacca belt. I'm going to teach you those things. But if all I did was say right external oblique does trunk flexion, right lateral trunk bending, and left transverse trunk rotation, that means nothing. You're still going to be just as confused. But if we do the process, I don't care who the specific muscles are right now because their names don't have pull in their names. What right external oblique? That doesn't tell me how it pulls. So what I want to do is I want to figure out the agonist as a group because the group has pull in its name. I can see who I need to pull because I see why I need them to pull. We see the group first because the group is translated into the pull, which we need to go against external forces. Once we have the group, then we could say, what specific muscles are in that group? Who is in that team? Who pulls that one? Does that make sense? All right. Let's do this. What are we going to do? Come out. See. What is this? Great. Of. Right. Outstanding. Right. Ankle. Plantar flexion. I'm going to have muscles that pull in the direction of plantar flexion. I'm going to call them the plantar flexors. Dr. Campbell, why don't you just say gastrocnemius? I'm like, that's fascinating. Why don't we say gastrocnemius and soleus and tibialis posterior and flexor hallucis longus and flexor? There's more than just one muscle. So to make it easier, we can say, I know I have plantar flexion pullers that sometimes I'm going to need to do a job. If I have something trying to dorsiflex me, if I'm up on my toes, grounding gravity's trying to dorsiflex me, I need my plantar flexion pullers. Because if I use my dorsiflexors, I would fall. Who are those muscles? I'm going to teach you, but it's a step-by-step process to make it easier when we get to who's on the team. But gastrocnemius doesn't tell me pull. Soleus doesn't tell me pull. Peroneus longus and brevis doesn't tell me pull. But if I say I need plantar flexors because I see why I need them, those muscles are, and I'm going to teach you how to see who's on that team. Is this, let's try it another way. True or false? Right angle inversion. It's one of my 310 trick questions. What joint is this? This is what I'm talking about. How, and it's not you, it's we got to get back into game shape. How am I supposed to get into specific muscles when we don't know specific motions? That's the subtalar joint, remember? The subtalar underneath the talocrural, underneath the talus lies the subtalar. The analogy I'll use in class is the skateboard where the ankle is like the wheel and the subtalar is like the wobble. Helps keep you balanced, but that's not happening in the same place. If that would happen in the same place, wheel, wobble. That'd be a bad day. We want to protect the wheel. A low ankle sprain is a subtalar joint sprain. And you can still run in straight lines with that because you're not affecting the ankle joint. A high ankle sprain, there's nothing high about it. That's an ankle sprain. Those hurt a heck of a lot more because you did damage to the actual wheel mechanism. Things like that, guys, you have to work on that on your own. You have to do extra work. I can't go back through 310. So that's why on the Moodle page, I have all your 310 materials and I have old lectures so that you could brush up on ankle plantar, ankle dorsi, subtalar inversion, subtalar eversion, and all the illusions. Left subtalar inversion. The same position. Okay? So that's homework. That's stuff you're going to have to do. Maybe you meet your groups and you get together and you do some, I think I said that dyslexic group meets. Okay, what about the knees? You flex and extend, right? Right knee flexion and extension, left knee flexion and extension. But what else can the knee do? You guys remember from 310? That's some rotation to it. You remember that? Lateral or external, medial or internal. And this was another 310 trick question, the cut and plant question, where your brain wants to say this is internal because you might see a knee coming in, but it's really external. It's all relative to the joint. Is any of this ringing a bell? Okay. I can't go through all of it again. I'm just giving you a lesson on, hey, we got to go back and probably practice some of this stuff. For our hips can move in all three planes. Sagittal, we're looking at flexions and extensions. Flexions and extensions. Here's the MVP 310. This is the exact same motion as this. Remember that? From the video. Yoink is the same as yoink. So if you have hip flexion and extension, we have to have muscles that pull in the direction of hip flexion and hip extension. We call them hip flexion pullers and hip extension pullers. I'm going to teach you who those muscles are. But you know what we can't say anymore? Quads and hams. Now, you could say that in the clinic. You're talking to Mrs. Thompson, who's 85 years old. Miss Shatner, we're not working right here. Oh, Miss Thompson, that's your quads. I have no problem with that, guys. I'm not saying you got to drop like Latin terms to Miss Johnson. I'm not saying that at all. You have to know what they are. You have to know what a vastus medialis, lateralis, intermedius, rectus femoris. You have to know what a semimembranosus, semitendinosus, biceps femoris, long head at the hip. You have to know how the gluteus maximus functions. You have to know what a quadratus femoris is. You have to know what an obturator internus, obturator externus, quadratus femoris, gemellus superior, gemellus inferior. You have to know those things because any of those muscles might need rehab, might need innervation, might need help, it may be too tight, it may be too loose. How are you going to stretch something when you don't know how it pulls? Does that make sense? We have to be beyond the glutes and the quads and the hams and the cores. But that doesn't mean you can't still use that verbiage with Miss Thompson. I'm not saying that at all. Okay? So, we have to understand that this is the same motion as this. However, when I do this, I need hip flexion pullers to bring me up concentrically. I'm going to teach you who those muscles are. I'm going to teach you about the rectus femoris. I'm going to teach you about the sartorius. I'm going to teach you about the pectineus. I'm going to teach you about specific muscles that are on that team. However, just because my hip flexion pullers did this doesn't mean those same muscles were responsible for the hip flexion when I did it like this. Here, gravity is trying to extend me, so it makes sense I'd need flexion pullers. Here, if I relax, gravity is trying to flex me. So it makes sense I would actually need extension pullers, my extensors working eccentrically to let me go down, and the same muscles working concentrically to bring it back up. We don't assume based off of motion. We can't say these specific muscles do this motion every time. Can't do it. We figure out the agonistic group based off of pull, and then all we got to do is say who's on that team. Who are the members of that band? By the way, Taylor Swift and Travis Kelce. America's about to get our first royal wedding. It's fascinating. I made a joke on my book face for my tens and tens of fans. And I was like, Taylor Swift is getting engaged to one of her backup dancers. It's true. All right, stop chasing butterflies. What about this one? Same concept, different plane. Left hip abduction. Left hip abduction. Remember that? You guys remember this one? Add. Gotta remember those things. Okay. Everybody do me a favor. Stand up. Stand up. One time, no promise. One time. One time. One time. Feet shoulder width apart. Show me left transverse pelvic girdle rotation with keeping both feet on the ground. Send your pelvis to the left transversely. Now, what I want you to do in your mind, and then who's next to you in small groups, we got to practice with, in my opinion, because if you just think of it yourself, what if it's wrong? How do you know? To me, you have to share with someone. Oh, we're getting the same thing. Great, we're getting different things. Well, let's talk about it. How did your left hip rotate when you got to that new position, and how did your right hip rotate? It's 310 stuff. So you're standing here, and you do left transverse pelvic girdle rotation. You don't have to say it out loud, but you need to be able to tell me how your left and right hips rotated. Okay? So ask your neighbor, or ask someone next to you, or get in small groups and try to figure it out to make sure we're on the same page, because it doesn't matter if I give you muscles. If we can't know the difference between internal and external rotation, you're going to get it wrong. Yes, I love the voices of chatter. It's all right. What's good? You can just go one step back and say, "Hey guys, what you getting?" Great. Sure. Anybody needs to go like. Okay. Standing, left transverse pelvic, left hip internal, right hip external. Let's go the other way. Right transverse, right hip internal, left hip external. Guys, think about it. If I say on the test, hey guys, what muscles would be responsible, even if I told you use these muscles concentrically and you right transverse pelvic girdle rotate while both feet on the ground, you got to be able to understand that if I have right hip internal, I have to use muscles that pull that way. So unless we get the motions right, the muscles matter. You can memorize all kinds of muscles all day long, but we have to apply it to real motions. Right? While you're up, I promise you I'd ask you to stand once. I didn't say for how long. Let's do this one. Standing, and you're in line for something that's taken a while. And you shift your weight from one foot to the other. What we're doing is right laterals and left lateral pelvic girdle rotations, and our hips are going to ab and abduct accordingly. And our trunk, if you're now we're just going to do hips for now. But let's say we have all of our weight on our right leg. Let me line up with you guys. All of our weight on our right leg. I'm giving you a hint of how my pelvis is positioned. Like the Lion King. And I go from my weight on my right, to the weight on my left. Does everybody understand what just happened? I would love for you to be able to tell me, how did my hips move? How did my hips move to shift my weight from my right to my left? And to give you a hint, it's not flexions and extensions, and it's not internal and externals. We're abs and adding right now, okay? So let's try to get that one. And Evan's going to be floating around on the left side. Grace will be floating around on the right side. My pelvis is tilted to the left laterally, right? It's pouring water out the left side. I don't know if you guys remember like pouring water or rotated. We gave you different ways to look at it. My right hip is adducted, and my left hip is abducted. And remember in 310, I said, guys, I didn't name these things. I don't know who named ab and adduction. It had to be Satan because they sound so close together. That's why I say things like especially being from adduction. What? So we have to differentiate two different motions that sound so similar. My right hip is ad, and my left hip is abducted. And when I go from here to here, the motion of my left hip is left hip adduction, and the motion in my right hip is right hip abduction. And the motion of my pelvis would be right lateral. Okay? I promise I'd only make you stand once. So while you're standing, let's look at the trunk. How the trunk can sway. Right lateral sway, left lateral sway. So if my trunk didn't sway when I started, when I would shift my weight, I'd be over here. So what I want you to notice is, reminder from 310, if my pelvis is tilted this way, but I don't want my sternum or my body to be tilted, I gotta bend, I gotta sway my tree trunk. So if my pelvis is tilted to the left, I gotta sway my trunk back to the right. You guys remember that? Because if I tilted my trunk, if my trunk stayed neutral, I would be here. I'd be like the Leaning Tower of Pisa. And if I bent my trunk to my left, I'd be picking up a bucket from the ground. So if my pelvis is trying to tilt everything to the left, but I want to keep my upper extremity level, I got to bend back to the right. You guys remember that? Okay. All right, now consider. Is this helpful? It's helpful. Good. All right. How about this one? How about this one? All right, I told you I wouldn't make you stand back up. I'll check out like this. Guys, we have to be able to figure these things out. Some of you will be able to figure them out in your head. Some of you may have to move until you can figure it out in your head. Reps. It's about practice. Okay? Here's the question. From bottom to top, I'm going to move the video camera so that we make sure. So when I go to the picture, screenshot it or take a picture so that you have the context. There it is. All right. They see me rolling. Screenshot. Such a boomer. Guys, you should be able to tell me how the pelvis rotated and how the trunk rotated. Two separate things. How did the basketball spin? What spun the basketball? Cap and bottle. Does that ring familiar in 310? How if does anybody have here's one. My peppermint. If I rotate the cap and the bottle in the same way, it's never going to open or close. They have to rotate in opposition for there to be differential motion between the two segments. Okay. So again, you can do it if you want, or you can talk about it, or you can do it in your head. But I need you to take a few seconds to tell me, how did the pelvis rotate and how did the trunk rotate from top to bottom? Go. Reminder, maybe this will help you. We don't look at things from a global reference. We look at things from a local reference. We can use bony landmarks. We just don't want to use my sternum versus the ceiling or my shoulder versus the floor. We don't want to do that. But we could say my sternum relative to my pelvis. How are those things lined up? What do those things look like before? What do they look like after? How did I have to move to make that change? All right, guys, I'd love to give you more time, but there's so much to do. I'm going to walk you down a path. How is the trunk? First of all, yes or no? Is the trunk rotated at the top? Yes. It's twisted. It's not in anatomical note. How is it twisted? To its right or to its left? It's right. How do you know? If you were in kinesiology court, and they're like, well, how do you know it's twisted to the right? All you got to say is, well, the sternum is looking at your right hip. And I don't think you could get to that position by rotating this way. If your sternum is looking at your right, your trunk has to be twisted to your right. It doesn't matter that I moved the bottle about the cat. It doesn't matter that I did this. I get to the same place. So my trunk has to be twisted to the right. Are we good? So that's my starting position. I'm twisted to the right. My trunk is right transversely rotated. Is my trunk rotated at the bottom picture? Lined up. Anatomical in terms of trunk rotation goes. So here's a simple logical question for the final step. If I start in Breaux Bridge and I end in Lafayette, how did I have to travel? West. If I start by being twisted to my right and I finish in anatomical, how did I have to rotate? To the left. Does that make sense? Guys, this is hard to see. So I'm not asking you to see it. I'm asking you to prove it. Using these landmarks, using these position changes. There's no other way you could possibly go from top to bottom without your trunk rotating to your left. Think of it like this. I'm going to do some silly things, and I'm approaching 50 years old, so there may be a time where I go down and I may not get back up. But until that day, it's possible to start like this, the position at the top, right? I could totally get to the same rotational position at the bottom by literally taking my trunk and rotating it to the left. Or I could take the pelvis and spin it to the right. The pelvis spun to the right, but the trunk spun to the left. Do you see the difference? Maybe my kids are right. I still have an open challenge. It has never been claimed, I think, because they're scared. But don't tell them this. I have a $100 bill sitting on my counter for the day one of my boys challenges me to a race that beats me. And it's still there. I think it probably could beat me, but they don't know that. I think they're like, well, what if the old man beats me? I'll never live it down. So it's just fun, the psychology of teenage boys. Does everybody understand? Okay. All right. How about we mosey on down to the cervical? And tell me what motion, if any, maybe the answer is nothing. I start here and I do this. We're doing cervical vertebra analysis. Start, finish, start, finish, discuss. Did my neck move? No. Just because I look to the right doesn't mean my neck twisted to the right. We don't assume. My head might have rotated relative to the room. Doesn't matter. I could be on a merry-go-round and have my body do this. Does that mean I'm spinning my head around? So we got to be careful. We can't just say, oh, if I look to the right, it's this. If I look to the left, it's that. We can't do that. Okay? All right, how about this one? So what I want you to do is start off with an easy yes or no question. Was there cervical movement? Yes. That's an easy start. Because then if it's yes, then you could follow up with, okay, cool. How? And if the answer is no, then you're done. Let me do it with you guys. So that way, if you wanted to. How did my cervical rotate? Outstanding, transverse, but I got two different ways I could spin in the transverse. So did I spin to the right or did I spin to the left? Left. Good. How do you know? Because that's the only possible way to go from being an anatomical or not being rotated to looking at your left shoulder. You have to look at it. Just like for a cap in a bottle, I can open that bottle, if that was a motion, by spinning the cap lefty loosey. But you know what else I can do? Spin the bottle righty loosey and still open it. That's all we're doing here. We're moving the cap and we're moving the bottle. And we have to be able to see where I start and where I finish has to be called the same thing. An analogy I use to pretend. Say, guys, if we're playing a board game, no pun intended with the board, but if I roll a dice and it says take 2 steps forward or go forward 2 spaces, and the small piece moves about the board to your right, if I kept the person still, do this next time you play in a board game, keep your piece still and shift the board to your left. The motion still has to be the same because you get to the same place. So this is weird, but it's true. Go forward 2 spaces. This is going just as forward as this because I'm getting to the same place. If it were possible for, yes, it's possible in gaming, they have different perspectives, but if you were here, small piece moves about the next piece on Earth, so we travel east to go to Port Rich. But if it was possible to keep you fixed and rotate the Earth the other way, the opposite direction, and you plopped into a bridge, you still had to travel east. Your chain is the same. So we have to remember that works for human motion too. The door always moves about the wall. But in our body, we can move the wall about the door. It's going to look different, but it's the same. We're used to moving small pieces about bigger pieces. All I'm trying to remind you is that if this is called opening, this is also called opening. Because it gets me to the same place. Okay? On Friday, we'll do upper extremity stuff, and we'll segue into contraction reminders. Guys, refresh on your own. Again, we don't have time to go back and reteach through 10, but go over the radial ulnar joint stuff and the illusions of the radial ulnar joint. Go over the illusions with the shoulders. Okay? All right, we're good. Is this review helpful? All right, guys. Y'all have a good one.